part 2, continuing with Mary Sue, 4-year-old, doing the pediatric assessment. So the next thing that we're going to do is look at her skin. First thing that I'm going to do is tell Mary Sue, is it okay if I touch your head? Yes, okay. So I'm just going to look here. Anterior and posterior fontanelles would both be closed at 4 years old. I'm just going to look for any rashes, any edema, any bruising. I'm going to check your arms. Is that okay? So again, I'm just looking for any rashes, edema, possible signs of child abuse, things like that. We would also check nail bed, and I'm just going to look for a cap refill, 2 fingers on that side, and then 2 fingers on that side. Okay. So then we're going to move down into the eyes, ears, nose, and throat, or mouth. Eyes, basically, I already did that, but I'm just going to check spacing and make sure that they're equal on both sides. Any discharge, any redness, any yellowing for jaundice. Then ears, we're going to, again, I've already checked ear function and cranial nerve assessment, but I'm also just going to look and make sure that the placement is the same. There's not one low set, one high set, and it's not molded onto her head. So I just want to check, inspect for ear placement and symmetry. Nose, I'm just going to, again, I've already checked this with cranial nerve, so I know that she can smell because she correctly identified vanilla. But I'm going to take my pen light that I lost, here it is, and check her nares for occlusion, and I'm going to check for deviation of the septum. I'm going to ask her to occlude one side and sniff. She can do that. Occlude the other side, sniff. She can do that. Mouth, I'm just going to look for a lot of drooling. At 4 years old, she shouldn't have any. I'm going to make sure she doesn't have any like bleeding gums. The lips are not dried and cracked. Looks pretty good. So respiratory, I'm going to move down and check lung sounds and check for the breathing, which I already did when I checked her vitals earlier. 1 full minute if there's a problem, if it's too fast, too slow, or 30 seconds and then times 2. Like I said before, her respirations are going to be faster than an adult, and that's normal. So respiration 20 to 34 in a child 4 years old female is normal. Okay. I'm going to just make sure that she's not having any signs and symptoms that would show me that she's having trouble breathing. It could be indicative of asthma, something like that. So if she has nasal flaring, it could be an indication, grunting, wheezing, if I can hear any inspiratory, expiratory sounds when she's breathing. And then we're going to auscultate the lung field. Well, first I'm going to palpate. Is it okay if I check your chest area right up here, right under your neck? Okay. So I'm just going to go in the front, and then I'm going to go in the back. And now I'm going to use my stethoscope, okay? So again, I'm going to use this. I'm going to listen for breath sounds on both sides, on the middle of the arm, and then in the back. Again, I'm going to listen bilaterally to make sure. Then we're going to go into the heart, cardio. Again, I already listened with my stethoscope to All People Enjoy Time magazine, which was aortic, pulmonic, Herb's Point, tricuspid, and mitral. And I already did the point of maximal impulse, which was the lowest point that I could palpate a pulse. And that's going to be the 5th intercostal space. Then we're going to do the carotid arteries one at a time. And I'm going to ask the patient to hold her breath while I listen for bruits one at a time. Patient holds her breath. Then one at a time. Patient holds her breath. Okay. And I'm asking her to hold her breath so that I do not hear the tracheal sounds while I'm trying to listen for a bruit. Okay. So I just finished the carotid artery assessment for bruit, so now I'm going to move down into the belly, and I'm going to have the patient lay on her back. Is it okay if you lay down for me? So the first thing that I'm going to do is just inspect her stomach, and I'm going to look in all 4 quadrants. While I'm here, I'm also going to check for any abdominal hernia, which would be an out protrusion above the belly button. I don't see anything. So then I'm going to palpate in all 4 quadrants. I start in the lower, and then go up, and then cross over, and then go down. And then I'm going to check while I'm here for the inguinal hernia, which I don't see any. And then I'm going to have her to sit up, and I'm going to check for the CVA tenderness, which is just going to be on her back. I'm going to place my hand, and then bump it with my fist, and ask her if that hurts. Which it doesn't. Then I'm going to go on down. Probably would have done that while she was already laying down. But I'm going to check her female genitalia. Just going to look, make sure that there's no vaginal discharge, things like that. For males, I would just make sure that they are circumcised. Again, I'm just going to look. So then the last thing that we're going to do, which basically I already did, whenever she walked in or whenever I walked in and I would have her hopping on one foot and standing on one foot, I was assessing her gait and make sure that that was appropriate for her age. For her posture, when she's doing that assessment, I can have her bend forward and I can put my hand on her back and just make sure that she doesn't have scoliosis. I would palpate the limbs. I'm just going to make sure that when I move her arms, there's no like crepitus, so I'm not going to hear any popping or any joint sounds when I do the passive range of motion. That's it. I'm all done with my assessment today. Do you have any questions? No? Okay, no. So I'm going to step out, enter all this information into the computer, and the doctor's going to be in soon. I'm going to open the curtain, remove the privacy, hand hygiene, make sure she has a call light, make sure mom doesn't need anything, and then step out.